We're going to have a conversation today about our eyelids. We all have them. We all experience some problems at times. And I want to just talk about some of the common ailments that can affect us. Eyelids are super important. We got to protect them from infection, and that makes our eyes very happy. The eyelids distribute oils, distribute tears. They keep things out of our eyes. So super important. We got to take care of them. So most of us do take care of our teeth. We address issues like biofilm and bacteria and inflammation in our teeth and gums. Same thing with our eyes. The eyelids are an easy place for bacteria to thrive, and we need to address that because it creates problems. So what are some of those problems? We know the word stye, S-T-Y-E, so you should all know what that is. It's an infected gland, can be super painful, and I'm going to just teach you why those things happen and what the terminology is. So typically what we see is what we call an internal hordeolum or external hordeolum, depending on which gland is infected. So you will feel this coming long before you can see it. It's just very painful, it's red, it's inflamed, and you want to treat this super early. So the common word for that is stye. Another word is once the infection is sort of reduced, it can turn into what we call a chalazion. And those chalazions take a long time to go away. They either need to be injected or lanced by surgery. So you don't want that to happen. So let's talk about it. Bacteria can harbor in this biofilm on our eyelids if we're not careful. So we need to reduce the odds of that happening. What we like to do is recommend a product called Hydrate, which is using hypochlorous acid. It's super safe, super gentle, but it really reduces bacterial numbers, helps you remove the biofilm from your eyelid. Now, in the event that you do get a hordeolum, infected gland around your eyelids, the first thing to do is grab heat. We prefer a heat mask that holds the heat in place for 6 to 10 minutes, as opposed to just hot water on a rag, which will just dissipate too quickly. But whatever it takes, get heat on your eyes as soon as you suspect a stye hordeolum, because it helps that gland to begin to drain. The body has a natural way of killing this bacteria, so it does a good job at that. Rarely do we need antibiotics or even oral antibiotics if we take care of these things early. A lot of doctors do prescribe an antibiotic drop or an ointment or something, but it really just can't get into the lid where the infection happens. We do need oral antibiotics if this infection is severe or spreading, so we're not opposed to that, but we know that early on heat, hygiene, it can take care of most of these minor infections in your eyelids. So the cause for these things is bacteria. The treatment is actually just prevention. Lid scrubs, daily lid scrubs. Use a product like Hydrate, which we have in our office, to reduce the consequences of what bacteria will ultimately cause. Now, a bigger concern is dry eye syndrome. As these oil glands become infected and affected by bacteria, they don't function as good as they used to. So ultimately, people sometimes tell us their eyes are not dry, they water. That's a common first symptom of dry eye disease, because oil glands produce oil that prevent evaporation, and when those are dysfunctional, then it can lead to a symptom like watering. So it sounds backwards, but that's very common misperception. So oil glands, meibomian gland dysfunction is a real condition that's very common. We photograph those glands with infrared cameras. We are able to show people what is going on. So to wrap up, a stye, hordeolum, chalazion, these are all sort of acute conditions that affect our glands. Usually it's a single gland, but meibomian gland dysfunction is more of a concern because it's affecting every single gland and ultimately leads to atrophy of the gland and can result in really severe dry eye syndrome. So it's important, take care of your eyelids, take care of the bacteria, step up the hygiene, and it's very important. So we are here to help you. If you're having recurrent styes or your first stye, let us take a look and get that handled for you. Call us if any questions, 478-987-2020. Thank you.